Addiction to alcohol and other drugs is a primary disease. The illness is chronic, progressive, and potentially fatal. According to the Centers for Disease Control, addiction is the third leading cause of death in the U.S. and accounts for up to 25% of all emergency room visits and 70% of all trauma-related emergency room visits.
Denial is the most primitive defense mechanism that we can use as a human being. People ask me all the time, how can an addict lose their job, lose their family, lose their life, and still not see that they have a problem? Well, they use this very primitive defense mechanism called denial. Even more importantly with addiction carries such a massive social stigma to it that the person doesn't want to admit that they're one of the lower forms of life as society looks at them, so they stick with the denial to their deathbed.
My first experience with painkillers was in high school after fracturing a vertebra. I really liked the way they made me feel. Although I drank a lot in high school and college, it wasn't until my late 20s that I developed a serious problem. After being prescribed painkillers for a broken ankle, I developed a habit, an obsession that would control my mind. I still didn't realize that I had a problem, but even once I did realize I had a problem, fear and shame and fear of rejection kept me from seeking help.
Although there is no known cure for addiction, it is treatable by detoxification, breaking through the denial, and teaching a new lifestyle that includes the 12 steps of recovery and treatment for the family.
One of the most important ingredients for a patient's long-term recovery is commitment to a 12-step program. As doctors, we can take the drugs out of their body, we can dry out their brain and hopefully get things working better again. But they need a whole new lifestyle change, a whole new philosophy of life, and that's what they get from the 12-step programs.
CenterPointe Hospital is a private psychiatric hospital serving the behavioral health needs of children, adolescents, and adults in the metropolitan St. Louis area, southeastern and central Missouri, and southern Illinois. It offers the area's only private residential treatment program for adults with an alcohol or drug dependency.
We are a behavioral health program, and I think it's very essential that every behavioral health program has some component of addiction and addiction disorders. CenterPointe, we as psychiatrists have a real passion to treat patients, and addiction is part of the disease process that we need to treat. Even though there are beds being cut all over, reimbursement being an issue, we tend to do what is right for our patients and the communities we serve.
Situated on 24 acres of rolling hillside, CenterPointe provides a tranquil setting conducive to reflection and healing. The program offers patients the potential to be free of their addictions and provides the knowledge and coping skills necessary to begin and maintain lives of recovery.
When I was 30, my body had had enough. I was suffering from liver failure and was admitted into ICU for a week. The doctors were treating me for liver failure as well as withdrawal at the same time. A family member and a recovering addict requested that I go to CenterPointe. I had no knowledge of the disease of addiction or the 12 steps. When I came to CenterPointe, they introduced me to the 12 steps, and the staff provided me with a plan to go by when I would be released. When I got out, I had a plan. The rest was up to me.
Education is one of the very basic and important ingredients of our treatment program, because all of us grew up with many myths and misconceptions about what addiction or alcoholism is. And until the patient has the proper facts about their drinking, about how the drugs affect them and what they do, they would have a very difficult time staying clean.
CenterPointe's Chemical Dependency Residential Unit and outpatient services specialize in the treatment of prescription drug abuse, the use of state-of-the-art FDA-approved medications in detoxification, and the treatment of patients with dual diagnosis.
Dual diagnosis is when the patient suffers from not one psychiatric problem, but two major psychiatric illnesses. So in our case, we have a patient who's an addict, and they also suffer from some other form of mental illness, such as major depression. That occurs in about 20% of addicts. They will be dually diagnosed. This really makes treatment more difficult because frequently drugs we might use to treat a psychiatric symptom we can't use in the addict because those drugs are addictive.
CenterPointe Hospital believes that addiction is a primary disease that is often misdiagnosed, and addicts are frequently prescribed inappropriate or ineffective medication.
Addiction is frequently misdiagnosed for a number of reasons. Probably the most common is that the drug or the alcohol they're using can cause symptoms that look like mental illness. Being high on cocaine, you may look manic. Crashing from cocaine, you may look depressed, so you get labeled bipolar. The other reason is obviously addicts are really good at lying, and if they're not telling the doctors the truth, they may be misdiagnosed.
CenterPointe's highly trained addiction therapists help men and women integrate the 12 steps into their lives, make the connection between their alcohol and drug use and their problems, and to learn to reconnect with their sense of self.
What makes our CenterPointe Hospital drug and alcohol program unique, we treat the more difficult patients, those who are duly diagnosed, suffer from addictive disorder and psychiatric disorders both. Our medical director is board certified in addiction, so are the other physicians, including myself, who are board certified in addiction, and we have a passion for these patients. We treat these patients in a medically safe environment using FDA-approved medications, which are new for addictions. In fact, we are also doing clinical trials where we are testing new medications that will help our patients in the future for addictions.
Addiction is a treatable disease, and recovery is possible. Stigma and denial are the primary barriers to patients and their families seeking treatment. If you or someone you know has a chemical dependency, don't wait. Contact CenterPointe Hospital today or visit centerpointehospital.com.